This week is National Infertility Awareness Week, a time to bring attention to something that impacts about 1 in 6 couples and often stays private for many families. Despite how common it is, there's still a lot of confusion around infertility, what causes it, and the variety of options to create a family. Dr. Alexa Clapp is a reproductive specialist with Aspire Houston Fertility Institute, where couples can get clarity and guidance on their family journey. Good morning.
Good morning.
All right, we were looking at the food in the kitchen over there, and we decided, okay, what came first, the chicken or the egg?
I'm always going to say the egg.
The egg always comes first. All right. When it comes to fertility issues, as you know, it can be so, and I've witnessed this with friends of mine, so stressful, but there's a way to get there, and you are part of that way to get there.
Yes. And I always tell patients the hardest step is making that first appointment, because you've thought about it, you've maybe second guessed it. So if you want more information regarding your fertility, make an appointment.
Yeah, and deal with somebody who is an expert in this. Correct. And there's a point in time where you end up with someone who's an expert like you. You're double board certified fertility specialist, former chief resident at UT Houston, a mentor in residency, inspired you to actually pursue this career, helping people to understand fertility, because you realize there were a lot of misconceptions out there.
Correct. Yeah, unfortunately, I think people don't, in the past, talk about fertility or infertility as much, and I think that helped generate misconceptions, also guilt, which is not what we want.
Yeah. They feel like it's something they caused.
Correct. Yeah. And I always tell patients the hardest thing is you have no control over this. Yeah. It's not a lack of wanting or trying. Infertility is a medical disease, and so we need to approach it from a treatment standpoint.
Yeah, and in that sense, we have more control over it than we ever have been because of what we know. Let's go through some of the myths that people have that I've heard thrown out there. This is a big one when women are on birth control, because you spend maybe the first part of your life going, okay, don't get pregnant, and then you're like, I now want to get pregnant, and they come off birth control. There's that myth that birth control actually causes infertility.
Correct. That is a common misconception. And birth control is used for, preventing pregnancy, but it's also used for many other medical conditions. And we know that it does not impact egg count, it doesn't affect the uterus, it doesn't affect the fallopian tubes, so it does not cause infertility. In general, your cycles, what they were before birth control, are going to kind of resume itself. And it should reverse pretty quickly. More commonly used birth control methods would be the birth control pill or the IUD, and your ovulation or your release of an egg every month should resume after stopping those methods pretty quickly.
Another myth, and they'll say, okay, maybe y'all are just too stressed out. Go take a vacation, right? And they say stress is causing the infertility.
Yes, and that's the worst thing to tell an infertility patient.
Who's already stressed out.
Exactly. It just generates more stress. And stress is hard to study. It's a hard variable to study. Looking at its outcome is difficult to study. Would stress cause infertility solely on its own? Probably not. Could it be a factor? Yes. And having infertility, going through the treatment is stress-inducing enough. So I think it's very important for some patients to have kind of stress-mediating coping techniques, and it's different for everybody.
Yeah, and some of that is just so the relationship itself doesn't suffer. Yeah, because that can be very contentious and hard between couples too.
It generates stress between couples. It interrupts your life. You're coming frequent for visits. So, some people will utilize acupuncture, or I like physical activity, journaling, meditation, yoga, even if you just take a couple minutes as a break to kind of take a step back.
Good practices for anybody.
Correct.
Right? Yeah. All right, another myth. Age only matters for women, and of course a lot of that myth has been driven by, we'll see like a couple of celebrities who are like 150 years old who are like, I'm a new father, right? but actually age can impact men as well.
Correct. I think we forget is male fertility and female fertility, two very common factors that we commonly see at the same time. And yes, while we cannot make new eggs, men, there is an age-related decline also. Now, it happens a little bit later than for women in the 40s and beyond, but you can see changes in sperm count, motility, morphology, decreased outcomes, DNA damage.
Yeah, and then we dovetail off of that. Oftentimes when there's a fertility issue with couples, people say, oh, it's automatically the woman who's having the problem.
Correct. 30% of the time there's a male factor, and an even larger component of time there's factors on both sides.
Yeah, almost 50-50,
Correct.
Right? All right. Next myth, treatment is kind of a one-size-fits-all. Well, what we know is that, first of all, you got to go in and determine where the problem lies,
Correct.
right? And it can be along so many different areas. I was telling you before the show, I had a friend who they tried for many years and finally went to a fertility specialist, and they go, oh, there it is, you just had a blockage.
Right.
They removed the blockage to the fallopian tube, and then here comes
Pregnancy.
baby number one.
Yeah. After we do the initial workup, I'll sit down with the patient. And I think it's super important that the patient understand why they have fertility issues. What's the diagnosis? And then what are our treatment options? Because commonly multiple options are on the table. And what's right for one couple is not necessarily
it's not
right
always
for
in vitro.
another.
Everybody hears the most popular one they hear about is in vitro, but they may not have to go that far.
Correct. And you know, it's my job to relay risk benefits of each option, success rates, but ultimately we move forward with whatever the patient's more comfortable with. And just because we start down one pathway doesn't mean we can't pivot at some point and reroute to a different pathway.
And so in vitro, explain that, because I remember when that first became a viable option, and people were talking about it, which did open the door to so many families.
Correct. And in vitro fertilization has come a long way, and that's where the technology really has come out of the field. In general, the idea is stimulating the ovaries, removing those eggs, creating an embryo in the lab, now even having the ability to genetically screen that embryo for extra missing chromosomes, or if somebody was worried about passing on a genetic disease, and then placing that embryo back
to ensure
into
the viability of that pregnancy in that way, to do that ahead of time.
Correct.
And it's interesting because, correct me if I'm wrong, but in vitro can almost happen like if you need somebody to carry for you as well, right?
Correct. You know, some people don't have, aren't born with a uterus, or maybe they have chronic medical problems that would not make it safe for them to carry, and we can use in vitro fertilization with a gestational carrier.
All right, I'm going to touch on something because I know a lot of times women will freak out and think, I can't have children if they've suffered a miscarriage. You know, I had 2 miscarriages, and when you have something like that, you're thinking, what went wrong? We should start with the foundation that it's common in nature.
Correct. Unfortunately, 20% of pregnancies will end in miscarriage. Most common cause would be a genetic abnormality. Again, nothing you cannot cause a miscarriage.
It's almost like the body knew what it was doing.
Correct. But once somebody's had 2 miscarriages, it usually would warrant a recurrent pregnancy loss workup. And again, it does not mean that you cannot carry a normal, healthy pregnancy.
You just figure out what the issue is to go ahead and support that pregnancy. All right, and the last thing is, of course, the big concern a lot of people have, and that was in the news recently, is can we afford this? Is money going to come between us being able to have a family?
And I'm lucky in that I have my own financial counselor for my patients, because you know, insurance is covering, most insurance covers the initial testing, and more insurance is covering treatment, which is great. It's fabulous. IVF medication costs are coming down, which is great. And there's different financing and grant opportunities. So the goal is to improve access to fertility treatment.
Thank you so much for sharing that information with us today.
Thank you for
having me. It can be scary. I've witnessed it with friends of mine. I wasn't sure. I had my son at 41. I wasn't sure if that was going to work out, but you know, that did. But so it's like I always say to my friends who are struggling, it's like you're already a mother. We just have to figure out how your child's coming to you, right?
Correct.
All right. To schedule a consultation at Aspire Houston Fertility Institute, you can visit aspirehfi.com. That's aspirehfi.com, or here's a number you can call on your screen, 713-730-2229, 713-730-2229.